This is Community Unity Now, the D Tycoon Show. That is Bill Morton, President of the Rogers Park Chamber of Commerce. I am Trudy Leong, Administrator of the Rogers Park Chamber of Commerce. Our very special guest today is Darryl Mitchell. He is a filmmaker and also an advocate for suicide prevention. Welcome, Darryl.
Thank you. Thank you for having me.
Nice to see you here, Darryl.
Thank you for having me. Thank you.
Well, Darryl, first of all, tell us a little bit about how you became involved in suicide prevention.
This is something totally new to myself. I'm a filmmaker. I had an experience back on December the 14th, which I never thought I would be in this situation. Basically, I was thrust into the situation, being an advocate for suicide prevention. I had a friend that took his life back on December the 14th, and it made me want to become an advocate to give those who are suffering or struggling with depression, to give them a voice, to be an advocate for those that don't have a voice.
So on December 14th, can you walk us through the day?
December 14th started out like any other day. A friend, Jerry, this guy I knew for a year. I knew he was struggling with issues. I thought to myself, well, maybe that particular day was different from any other day. I said, well, something was off. I said, Jerry, I remember asking him, I said, Jerry, what's going on? And he really didn't share with me that day. That was the first red flag that I missed. That was the first red flag. That started off like any other day. 2 hours into talking to him, Jerry took his life. I struggle with it, thinking and wondering, was there something I could have done to have prevented that?
So you're looking at warning signs, studying the warning signs, and getting therapy yourself as well.
Correct. That experience woke me up. It educated me more. I thought I was more up to date when it comes to the warning signs of mental health issues and struggles, but that only solidified, and I think it heightened my sense of being more aware of depression and struggles, mental struggles. Sadly, it took someone close to me to have took his life, to have educated me more about mental health issues and struggles.
Mm. And this was your first brush with someone who committed suicide?
Yes.
A lot of times we have friends or family, people we care about, and they pass away in one way or another, and we see them for the last time, and we don't realize it would be the last time. And it seems not so important on that day, maybe, but as we look back on it, it was a very important day.
It was reflecting back on it, to piggyback off what you just said. It was a very important day. That day, luckily I saw him that day. It was a very important day, and I thought, wow, at least I got the chance to have seen him talk and at least hugged him that day. It was very relevant. I didn't realize it back then when it happened, but now looking back on it, it was a very important day.
When you spoke with Jerry and now you look back at what happened that day, are there any indications of maybe there are some other people that you know that have signs of what Jerry had been going through?
Fortunately, the people that I know now does not have any of the signs that Jerry had displayed. I think that incident with Jerry really heightened my sense of awareness. If I were to encounter that in any shape, form, or fashion, I would immediately jump into action because of the extra sense of awareness that I had gotten out of the experience.
Mm-hmm. And have you thought about what you could have done? Let's say you knew that was going to happen. What would you have done?
I would have spent more time with Jerry. I would have helped him seek the help that he needed. I would have went beyond what I did on that particular day. I would have really went that extra mile to get him the help that he needed.
Because if you saved him on that one day, and if he did not get the help, there would still be another day, and you might not be there.
Well, that incident, there was so many glaring things that was pointed out on that particular day. The wraparound services that he needed, professional mental help he needed, support from others, support from the community that was just not there for him. So there was a lot of the cover was basically pulled back on the services that are not there.
Were there services that should have been promised to him that were promised in, let's say, public service announcements and websites that the people, those services are available for people, but when actually they were not?
Jerry, unfortunately, was one of those individuals that fell through the cracks. And yes, there are services out there, suicide prevention services out there, but it's just not, I wouldn't say it's not adequate, because definitely it's adequate, but there's just the total wraparound services, it's not there.
Do you think that Jerry would have been willing to get help?
He would have. He would have. I tried on numerous occasions to get him the help that he needed. And for a while, he was doing good. He was doing good this past summer. Last summer, he was doing great. Got his apartment the first time. He was off the street. I seen, he looked like a totally different person when I first met him. I said, well, this is a huge step up. But he struggled with isolation, loneliness. I witnessed on several occasions how the community treated him. They outcast him. They did not look at him as a human being. That was one of the first things I had took notice of, and I said, I'm not going to treat him like that. I think that was one of the reason why I stepped out and befriended Jerry, because I saw and I had witnessed the treatment that he got from the community in Oak Park.
So it seems as if his setbacks derive from people isolating him and outcasting him.
Took a mental health effect on him.
So on that day, you said there were signs. What were the signs that you noticed?
I noticed that Jerry, he had a far off look in his eyes. Typically, when I would talk to Jerry, he always was a nervous person. But on that particular day, he gave me this look, it was a far off look in his eyes. I really cannot put it into words, and I'll never forget that. He had a far off look in he was just not there. I seen it in his eyes. And that was the first warning sign that I wish I could have. I wish I could have done more. I wish I could have done more.
Did it seem as if he were looking at a distant place, or did it seem as if he was thinking of something and wrapped in thought?
On that particular day, he was there physically, but mentally he was not there. It was as though he was looking past me, and this is off. And typically, he would call me D. My name is Darryl. He would call me D. But on that particular day, he said Darryl, which was surprising to me. I said, that's interesting, because he never called me Darryl before. So that was another red flag. And when I went in for a hugging, an embrace, to let him know that I will be back from the store within 2 hours or less, he pulled back a little. And I said, that's the warning signs I missed. That was not in his character.
So it seemed as if it was out of his character to call you Darryl too, and then it seemed that he was kind of like partially another person that day.
Yeah. He was not himself that day. I think based on his actions, he had it set in his mind that what he was going to do, and he did not want to hurt me or did not want to involve anyone else.
Did he ever, before, contemplate suicide? Did he ever confide to you?
He never took actions in regards to wanting to end his life. He talked about he wished that he was never here, but he never, or at least he never discussed with me any plans or any intention to take his life or anything. Never.
And was his life kind of going better because he had a place to live and other things?
Yeah, that was one of the improvements I saw in Jerry. After he received his apartment, everything seems to be going in the right direction. He was more positive, more outbeat, more outgoing. He had hopes for the future. And I said, wow, I like that. He gave me hope. That's why he made me believe in him more. But I know towards the end, his demeanor changed. I remember on a couple of occasions I would mention to him about being grateful for what he got, which is his apartment. One of the things, I said, Jerry, you got your apartment. That's a step in the right direction. I remember him saying, quote, Darryl, yeah, I got an apartment, but it's just not enough, unquote. And I remember asking him, saying something to the effect of, what else is it that you need or want? Again, he would always talk about being isolated and lonely. No one really spent the quality time with him. He and I, we planned it on, I was hoping that we would have spent the Christmas holiday with each other. We talked about that. I told him I had no plans to spend with my family on that particular day. I would like to have spent that time, the Christmas holiday, with him. And he was looking forward to it.
When you talk with Jerry, when you meet him and talk with him on other occasions, were there any other signs when sometimes he seemed different?
Jerry, one minute he would have a totally rational conversation. The next minute he would start crying, asking me to hold him. It confused me. I didn't know how to respond. I'm no professional. I'm no therapist. I didn't know how to respond. I did the best I can do in those moments. I embraced him and told him just to hold on just a little longer. Things will get better. Just keep a positive outlook on life, a positive attitude. Things will get better. And for a while, he listened to me.
Did he have any therapy before?
He did. He talked about returning back to therapy, professional therapy. He had a therapist, but he would tell me even then the therapist was not enough for him, and I understood that because I would ask him on several occasions. I said, Jerry, you have a therapist? What he would always say over and over, the common thing when he said, Darryl, I don't have anyone I could pick up the phone to be able to call to do the things that you and I do, and it was a telltale sign that he was really struggling with isolation, loneliness.
And besides spending time with you, was there anything else that he did that helped him alleviate the isolation?
Jerry was a jokester. He was a real kidder. He loved being around kids. He would always say kids, are pure innocent. He loved being around kids, and that brought him joy. Sometimes he would go around, just walk past the school hours just to see the kids playing. I've seen the smile on his face, and I would say, Jerry, why don't you go into the schoolyard just to interact with the kids? But he said in the past that parents would chase him out of the schoolyards because of protection and safety issues, and I understood that.
So on the day you saw him, you were going to the store,
Mm-hmm.
and I know that there's a Dunkin' Donuts right over there, but there was no way for you to know.
Yes, exactly. There was no way of me knowing that was what was on the horizon that particular day. No way I could have even fathomed what he was about to do. There was no way of me knowing.
So you wouldn't have thought, oh, come on, let's go to the store together, or let me get you a coffee, or anything. You just had your conversation and went on your way.
Exactly.
And you had no idea.
No idea. No idea that was about to unfold.
And Jerry knew that you are a filmmaker.
Mm-hmm.
So what made you feel that you could, instead of doing entertainment films, that now it's time for you to do a documentary to help prevent suicide?
One of the things, if there's anything that I can extract from that to help others, is to use the talents and the strengths that I have, is to bring awareness, to put it into film, to add that into a school curriculum, to teach students at the earliest age possible, to be just to educate the students, the pupils more about the warning signs, and to bring more education and more awareness about mental health issues at the earliest age possible.
Did Jerry ever confide to you that when he was school age, he was having trouble, and that if he had a little bit more guidance, and during that time, he would have been better off?
Briefly, he would tell me about his childhood, how he grew up, and he felt like he never belonged even as a child. He was the only child. And I said, Jerry, do you have any siblings? He says, no. I says, How was school? He said, it was challenging for him even in school. He did graduate. And I says, well, what was the reason behind that? Because he said he was bullied, picked on, just felt like a social outcast. Therefore, he dropped out of school. Even as a child, he never felt a part of.
So do you feel that for suicide prevention, a documentary about the suicide prevention would addressing issues of bullying and isolation be part of that documentary?
Absolutely. I think the younger, at the earliest is the better. I think, the bullying, definitely we've got the word out there about bullying and how it can have an adverse effect on students, adults, you name it, across the board. But I think there's so much more needs to be brought to the forefront about bullying, exclusion as opposed to inclusion, more open-minded, awareness. I think we still have a ways to go to educate the public more. We've made strides, but there's much more work that needs to be done.
So what have you learned and taken away from this experience so far that you will apply to your documentary?
Oh, God. Oh, wow, that's a great question. I want to use it to educate the public more. I want to break the stigma that's attached to mental health.
Stigma?
The stigma that's so prevalent out there. Mental health awareness has made strides, but the stigma still exists.
So in other words, the stigma of the patient stigmatizing themselves, and a stigma from society toward those that do have therapy.
Yeah, exactly. Even in the entertainment industry, it has made some strides that I'm so glad more prominent figures in the entertainment industry have spoke up about mental health, the stigma that's attached to mental health. But I think it will have more of a profound effect if more established entertainers were to step forward to educate the public more, bringing more awareness to knocking down the stigma that's attached to mental health issues. I think it will have more of an impact.
Do you feel like the system failed him?
Yeah, yes. I witnessed on several occasions when Jerry did his best to get the help that he needed. I seen how I was with him on several occasions how he fell through the cracks financially. I've seen it. I witnessed it.
So was it him applying for help, registering for help, and getting a runaround?
It was, and mostly and mainly it was in part because of his insurance or lack thereof. He had the Illinois health insurance, which does not cover a lot. It's very limited at what they cover. A lot of the services that he needed, the Illinois insurance that he had, did not cover the services that he needed.
So he was pretty low income. So he probably had ACA care, right? The Obamacare.
Mm-hmm. Very low income. Mm-hmm.
And then that was not enough for him to use for therapy.
Mm-hmm. Mm-hmm.
And you noticed that when you were with him?
Mm-hmm. When he applied for the services that he needed, because again, lack of insurance limited his access to the health care that he needed.
Mm-hmm. Did you go with him to maybe his primary care physician to support him to get help in other ways?
On several occasions, I would go to him to his PCP and trying to be an advocate for him, to speak up for him where he was not able to speak up for himself. And his PCP person on several occasions explained to me because the Illinois Medicaid did not cover the services that he needed and that was warranted in his case, his services that were available to him were very limited. And I thought, well, that's an issue right there.
Have you been able to speak with any legislators, elected officials about your concern about this state of lack of mental health care?
That is one of the things that needs to be to address is the lack of affordable health care, more specifically in the state of Illinois. I can't say nationally, but speaking locally because of my experiences, it needs to be brought to the legislators here in Illinois about the lack of healthcare, mentally and physical, health-wise. It needs to be brought to the officials' attention here.
And you hope that your film will bring the advocacy, will get to the students as well as the legislators, and bring the positive change to bring more resources to people with mental disabilities.
Yes, this is what I'm hoping for. I like to coin it as not a them or there. It can be an inclusion, as you just mentioned there, the students as well as the legislators. I think to work collectively, that's the only way we'll be able to solve this issue, this lack of affordable health care or adequate health care, I should say.
And sometimes it's the priorities too that are not arranged accordingly that would facilitate better mental health care. What?
I'm sorry.
No, you finish, please.
One of the things I would like that needs to happen, regardless of the community or their person's ability to receive the services that they need, there needs to be a healthcare system, a lifeline, if I can use that term, to be able to service individuals and or their families, regardless of ability to pay for the necessary healthcare, whether it's on a sliding scale basis or low to no cost paid. But the system needs to. Changes are necessary at this point.
And I know this didn't happen within the city of Chicago proper, but within the city of Chicago, a lot of mental health care facilities were cut during Mayor Rahm Emanuel's era. Some of them are, some new ones are coming very recently, far too late in my opinion. And then there's also the signs on the CTA tracks that say CTA suicide lifeline.
Mm-hmm. I agree. Some of those services that were cut years ago slowly or surely coming back online, but not at the speed where it needs to be, not up to par. The service, it's not coming back up fast enough. Services that were decimated years ago, the effects are still being felt to this day.
Was Jerry also living in Oak Park, or was he living in Chicago?
He lived in Chicago. He said he would come to Oak Park because he felt more safer there in Oak Park versus the city.
Mm-hmm. So when he sought help, it was in Chicago that he was seeking mental help.
Mm-hmm. That's where he initially was seeking help, in Chicago, because he was a Chicago resident.
And just to close this up here, we have about 30 seconds. What would you say to someone who needs help?
To reach out, don't be ashamed to reach out for the help that could save your life or your loved ones or someone you know. Don't be ashamed to reach out. Reaching out can be a lifesaver. Be that advocate for someone who cannot advocate for themselves or even for yourself. Be that advocate for yourself and for those who need an advocate. Reach out.
And if our viewers want to contact you with the stories it's just for more information, where should they go?
They can contact Darryl Mitchell at 2016@yahoo.com and or phone number 773-484-8235.
Can you say that one more time, please?
They can reach me at Darryl Mitchell 2016@yahoo.com and or 773-484-8235.
Well, Darryl Mitchell, we wish the very best for you, and then also good luck on the documentary. Hopefully it will help a lot of people, help the kids. This is Bill Morton, President of the Rogers Park Chamber of Commerce. I am Trudy Leong, Administrator of the Rogers Park Chamber of Commerce. Thank you, Darryl Mitchell, filmmaker and advocate for suicide prevention, for joining us on Community Unity Now, the D Tycoon Show. Thank you so much for watching, and we'll see you again next week.